To date, the COVID virus has claimed more than 4.5 million lives and has significantly impacted the entire globe. Vaccine rollout is the key we need to restore our usual lives and to open the world back up. However, vaccine rollout is not an effective strategy if we don't address the factors that limit vaccine uptake, such as vaccine hesitancy. Addressing concerns of confidence, complacence, and convenience will be key to overcoming this barrier in uptake. To do so, our group proposes 5 key actions.
The World Health Organization has identified vaccine hesitancy as a top global health threat. National surveys indicate that specific ethnic and religious minority populations are much more vaccine hesitant. Subsequently, the WHO has enlisted respected community figures, particularly leaders of faith-based and ethnic groups, to enhance community trust and increase vaccine acceptance. Yet, unarmed with evidence-based information, leaders cannot inspire nor transform individual thinking patterns. To this, we propose that community leader training programs focusing on COVID-19 and vaccine literacy are administered by the local government. This can be promoted with incentives such as government funding provided to participating groups. Community leaders equipped with vaccine education, such as vaccine safety, efficacy, distribution, and mechanisms, can deliver evidence-based and culturally relevant information in response to individual needs, concerns, or calls for guidance. Such training is also recommended for all members of the medical community to ensure they are armed with evidence-based insights when interacting with their patients.
Concerns about the development and side effects of vaccines are significant global drivers of vaccine hesitancy. Misinformation about COVID-19 vaccination further skews beliefs and behaviours towards the vaccine. A lack of effective public health messaging reinforces these issues. People are more likely to receive a vaccine if they believe that the benefits of doing so outweigh the risks, and this balance is heavily dependent on the information they receive. Therefore, education on vaccine development, mechanisms, and side effects, coupled with attempts to reduce exposure to misinformation, would permit better informed choices about vaccination. Such a campaign could include dissemination of information by the WHO via media and social media, labelling social media posts as fact-checked by qualified scientists so users can distinguish content which is evidence-based from that which is not, and finally targeting social media influencers to help dispel misinformation and promote constructive discussion around vaccination.
What happens when we have people interested in the vaccines but with no way to get to them? In 2020, there are 3.4 million individuals living in rural areas with limited access to vaccines. This number does not include individuals that are homebound or have difficulty accessing the community. Our team is proposing student-run mobile clinics as a solution to improve vaccine accessibility. Mobile clinics have been a well-established solution to provide accessible healthcare to individuals. They have the capabilities to store and administer vaccinations and to monitor and intervene if there are any vaccine-related side effects. With our hospitals filled to the brim, we are also advocating for student-led clinics. In one study, 99.9% of patients in a student-led vaccination center felt that their experience was either similar or better than previous vaccinations. Hence, we believe a student-led mobile clinic will be able to provide quality vaccination experience to those who have trouble accessing vaccines.
While countries are still dealing with the vaccine hesitancy, the problem of vaccine wastage arises. The majority of the COVID-19 vaccine were being purchased by countries with higher gross domestic product, leaving only 3.3% of the population in Africa are fully vaccinated. Our team is focusing on the vaccines that are not used by the expiry date. India reported a 6.5% of national vaccine wastage, and France for up to 30%. These waste vaccines could have been better utilized through donation to the WHO COVAX facility. The lack of transparency on vaccine wastage could be the reason, as the index are positively correlated with the quality of governance. In response, we suggest making it mandatory for governments to report the vaccine wastage rates and situation, as to achieve counter-monitoring between countries. A team could be formed by the WHO to ensure the credibility of data. Conferences can be set up to discuss agreements on sanctioning countries with higher vaccine wastage, similar to the current net zero emission effort.
Another solution our team has proposed regarding the lack of vaccine distribution to lower-income countries is to increase the number of partnerships amongst countries or organizations. For instance, the Partnership for Healthy Cities is an initiative supported by Bloomberg with WHO and Vital Strategies. This targets low and middle-income countries to ensure vaccinations are happening as quickly as possible, especially in high-risk countries. Private sector companies can also team up with global institutions for greater access and equitable distribution of the vaccine, like BioNTech's involvement in the COVAX program, in which they pre-purchase large quantities of vaccine from the major manufacturers. Current vaccination situation has brought to light and exacerbated current healthcare inequalities, and the issue of vaccinating the world can't be addressed adequately until these inequalities have been balanced out.